to give you guys the latest update on what is happening in Utah. Eddie, thank you so much for joining us.
Of course.
So the latest data that's come out today is that Utah has reported 4,672 cases and 46 deaths. It's an increase from yesterday. Can you talk a little bit about if we are seeing a flattening of that curve still, or if we're starting to see a decline in case count at all from last week?
Yeah, it's a great question that we'll kind of walk through here a little bit. If you look at the epi curves from Utah Department of Health, which are very similar to Intermountain's curves, what you see is a flat curve. You see that our rates really went up, right, kind of March 15th into April 1st. And then from there, they've remained relatively flat. If you actually look in detail in the last couple of days, some of the dates are actually increased compared to the week previous. But you have to put that into context of what we're doing with testing. And so we have a flat curve, which is awesome, which is great. That's exactly what we wanted. And we've also increased our testing, and we're now testing over 4,500 people per day. Contrast to that, 10 days ago, we were testing 2,500 people per day. And so we've almost doubled the amount of people we've tested, and our curve is still flat. And so that's a really good thing. And that tells us that, okay, for the state of Utah, things are relatively stable at a state level. But that really isn't the only measure we need to follow. One of the big metrics that we really keep a close eye on is how many patients do we have hospitalized with COVID-19, because that really gives us a better sense of the community transmission and the severity and intensity of the transmission. And for us, that number has been relatively flat. We have about 50 patients with COVID-19 in our hospitals across Intermountain Healthcare. That number's actually dipped down a little bit. And so we're now down to like between 40 and 45 on average. And our unique number of patients coming in with a new diagnosis of COVID each day has been stable and down a touch. And so those are actually really pretty good signs, but they're not signs to show us that the trend is going way down. What we can say with the data we have is that things are stable with some signs of improvement at kind of a 40,000 foot view. That said, we've been talking about this time and time again that, COVID is all regional. It's all based on your community. And so if we look at the state level, we get an idea of what's going on in the state, but you really have to focus in on each community. And right now, one of the big hotspots we have is Utah County. And what we're seeing is some of our numbers at IMC, Intermountain Medical Center, has decreased, but the admissions at Utah County is going up. And so, they have at Utah Valley Hospital the same amount of patients hospitalized with COVID-19 as we do at Intermountain Medical Center, and our populations are different. And so it's really pretty concerning in terms of the increase we're seeing in Utah County, even though we're seeing stabilizations or improvement elsewhere.
That's really interesting to note that it definitely has to do with where you're located and how that is going to impact what you're doing. And along those lines too, the state has announced that we're moving into this new orange phase and more businesses are going to be opening up tomorrow. I want to focus a little bit about what that means as far as masking in public and why you should be wearing a mask in public, how this is a good thing for not only you, but the people around you, and that social distancing is still one of the most important things that we can be doing. If you could talk through a little bit about why those things are still key starting tomorrow.
Yeah, just because we're moving red to orange at a state level doesn't necessarily mean that we can get any more comfortable with gathering in big social crowds or not doing some of these public health measures. And so masking is a great example. And so, we got to think about, why do we mask? And we're not masking as we go out in the community to protect ourselves from inhaling, COVID-19 or SARS-CoV, the virus. That's not the point of the mask. The point of the mask is the fact that there's a lot of people in our community that are asymptomatic, feel totally fine, yet they've got virus in their nose or in their mouth. And when you've got virus in your nose and your mouth, and you're out in the community and you're talking, you're interacting, you're touching your nose, you're touching the apple that's at the grocery store, you're transmitting that virus to your environment. And if you're wearing a mask and you have asymptomatic infection in your nose, you're no longer transmitting that virus into the community. You're no longer taking that virus that's in your nose that's now in the cash register or, wherever it might be. So the whole intent of wearing a mask is to really decrease the amount of viral burden that people that have asymptomatic infection are putting into the environment. And so if we all wear masks, that means we're all not contaminating the environment. And that means that we're not going to be picking this up as we go around and we touch things and then we touch our eyes or nose or our mouth. And so it's really, really important that we really increase mask usage. And I'm sure you've seen it's pretty spotty. There's some places that are really good at this and there's other places that are not. And it's still a huge public health emergency for us. And so we all need to rally and do this for the good of our communities. And I do worry a little bit about, opening up. We really need to think about opening up in the context of our communities. And so, if you're in a community where your rate is declining and the hospitalization encounters are declining, that's a good time to start loosening. But if you're in a situation, Utah County is a good example of this. If you're in a situation where you're actually having rising case counts and rising hospitalization, that's the absolute wrong time to open up. And so you really need to be county by county, city by city, looking at what are the regulations for that.
And you mentioned the importance of masking too. I know that they can be an uncomfortable thing for some people to wear. I think it's really important to know that it's also a sign of respect for others around you. The grocery store workers have to go to work and they need to keep our economy and business and state running. And it's a sign of respect to wear a mask for them because it lets them know that you care about their well-being and their health, which I think is very important.
It's a sign of your commitment to public health. It's a sign to your commitment to your community and keeping your community safe. And yeah, they're a pain. It's uncomfortable. It's annoying, but you get used to it. I was wearing a mask all day today. I was at the hospital. And, you just got to do it. And it really is a sign of respect for your community.
On another note, too, we've kept getting questions frequently about antibody testing and whether that's available now to the public or if the qualifications have come out about who qualifies for testing. Do you want to speak a little bit about that?
Sure. Yeah. So antibody testing is certainly now in the community. There's a couple huge caveats to antibody testing. What it does is it determines whether or not somebody has been previously infected with SARS-CoV-2, the virus that causes COVID-19. There's lots of different tests on the market, and only a handful of them are FDA approved or under FDA evaluation. And so you really have to be careful in terms of what test you're actually getting done in terms of whether or not it's a good test. So let's just assume that it's a good test. There are a number of instances where you could consider getting antibody testing. We sometimes use these tests in the hospital in patients that have symptoms of coronavirus, but have had symptoms for over 8 days. And at that point, your nasal burden in your nose goes down, your antibody levels are going up, and it could help in the diagnosis of acute COVID infection. So that's one, but it's going to be a relatively rare instance. The second is in people that have had high risk exposures to patients or loved ones that have had coronavirus. And so a great example of this would be somebody who is taking care of a person who's sick with coronavirus, certainly highly exposed to that person. And you want to make a determination of whether or not they've been infected and developed antibodies. So people at high risk exposures, that includes our healthcare workers who may have had exposure in the emergency department or on the floors or in the clinics. Okay, so that's another category. And then the third category are people that have had a respiratory condition that was consistent with COVID-19 in the previous 3 months, but never were diagnosed. So maybe never had a nasal swab done, never sought care, but they had fever, cough, and shortness of breath that has a syndrome consistent with COVID-19. This test could tell you whether or not that was COVID that you had maybe back in March. Now, the biggest issue with this is that we don't know what a positive test means besides the fact that you had been previously infected with coronavirus. Okay, I can't tell you with good faith that a positive antibody means that you're immune to coronavirus. I can't tell you that you are not at risk for getting it again. We just have no idea. The science isn't there. We haven't been with this virus long enough to know what that positive antibody means in terms of, does it protect you for another infection in the next 2 months next 2 years, next 2 decades? We just have no idea. And so we're really trying to temper the enthusiasm of antibody testing in the community, because it's really hard for us to counsel you in terms of what that means. And we really, really want to emphasize that if you go get a test and let's say it's positive, that by no means changes the way you should interact with your community. And by no means does that tell you that you no longer have to socially distance, that you don't have to wear a mask. That's absolutely not true. All it tells you is been infected. And so it's going to take a little bit for the science to catch up here. And I suspect we're going to know more in the next coming months. The science is moving incredibly quickly, but the tests are available. It tells you whether or not you've been previously infected, but what that means in the long term in terms of going forward, we just don't know yet.
Another opportunity that Intermountain is also involved with, kind of along that same lines, is our plasma clinical trials that we've been doing. We are looking for people to donate plasma who tested positive for COVID-19 and have recovered. Do you want to explain the importance of this trial and why people should participate?
Yeah, so what we're talking about is convalescent plasma or convalescent serum. And the thought of that is you take somebody who's had coronavirus that have subsequently recovered, and they now have antibodies and they have the immune response in their blood. And if we can take that serum and give it to somebody who is severely ill with COVID-19, that potentially could transmit the antibodies that have been protective in the previous person to them, and they can get better with it. Okay, so it's convalescent serum. And so it is a promising treatment. We don't have any data to say whether or not this really works or not, but the prelim data is encouraging. Okay, so we're seeing some signals that this may have a significant benefit. And people are doing this across the US, across the world, and are actively studying it. And so this is another therapy that we're offering through our Intermountain facilities in order to give to patients that are severely ill with COVID-19. And so the way you qualify as a donor, if you want to give plasma that has these antibodies to the Red Cross, in which they then give it to us, is you have to have a positive coronavirus nasal test, one of those nasal PCR tests, one of those swabs in your nose that has to have been positive. If it's been positive, you can contact the Red Cross, and there's a number of ways that we can do that. And hopefully you can show the listeners how we do that. And then you can start the process of donation with the Red Cross. And then we go with the Red Cross, and we have a patient that needs it, we'll contract with them and be able to potentially give them a transfusion. So it's a very promising therapy. And so if you've been infected with COVID in the past, please donate. We would love for you to go and donate your plasma because we really need people of all sorts of different blood types to be able to do that. And so, if you're blood type A, then you can only transfuse to the same blood type. So we really need lots of people to go do it.
And I just put that link up there. It's just redcrossblood.org/donate blood. They have a lot of really good information on there. They also have information on there about if you haven't tested positive, what you could potentially do in the future to join the trial. So it's a good resource to check out. My last question for you is similar to the trial question about any progress or promise we've had in finding a therapy to treat COVID-19.
Yeah. So there are lots of studies ongoing about therapies for COVID-19. There are whole different classes of medications we look at. So one class of medications are immunomodulators. So this is where hydroxychloroquine fits in. Hydroxychloroquine has been in the news in the past week. The FDA came out and had a pretty stern warning that says patients that are outpatient or ambulatory should not receive hydroxychloroquine unless you're in a clinical trial. And the reason that is because of some safety issues. And so pretty strong warning from the FDA to say, if you're a patient that's in the community, hydroxychloroquine is not for you unless you're in a clinical trial. And so we have our clinical trial that's currently enrolling and doing quite well from an enrollment standpoint. And we are able to monitor hydroxychloroquine and its safety very well through a clinical trial. So we want to just make sure that unless you're in a clinical trial, you should not be taking hydroxychloroquine as an outpatient. Okay. The data on hydroxychloroquine is coming in. It's not looking super promising to be super effective. But the only way we find out is by doing good randomized controlled trials. So we'll have more data on that soon. But the data looking at retrospective studies have been pretty spotty. So immunomodulators are one. Then you have the direct antivirals. And we have one drug that's in that class, and that's called remdesivir. And remdesivir has been in the news a lot in the past 48 hours because there was some release of a number of different studies looking at the impact of remdesivir in hospitalized patients. This is an intravenous antiviral. It's given to hospitalized patients, not outpatients. And there's a signal that it decreases time to improvement. And so in the study, it looked at people that were on drug improved in 11 days versus 15 days that were not on drug. Another study's coming out just today that looked at remdesivir in another population, showed no difference. Okay, so there is a hint that remdesivir, or this direct antiviral, may significantly impact the course of COVID. And so that's encouraging. And we're now looking at how do we obtain remdesivir for our intermountain patients. The University of Utah has a trial looking at remdesivir. They're part of the Gilead trial, and that's currently actively enrolling. So that's definitely potential. And then the third therapeutic arm is convalescent serum, which we just talked about. So it's immunomodulators, antivirals, and convalescent serum, which also is promising. And then the whole other arm, what we haven't talked about, is prevention, and that's vaccines. And there's over 95 different vaccine candidates currently in the pipeline. A number of them are further along, but honestly, it's going to be 18 to 24 months before we have a vaccine that could potentially be given to the public. So we're a long ways out on that.
Well, it's good to know that there's movement happening.
Mm-hmm.
There's definitely a lot that's happened in the last 4 months. And you always point out this is a novel coronavirus. It's new to us. It's new to science. So I think it's important for people to just be patient and realize that as you guys learn stuff and the experts learn stuff, you guys will let the public know what's safe and what's the best practice. So Eddie, thank you so much for joining us. We really appreciate it. These updates are really great for me and also our community just to learn about what's going on. So thank you so much. And if anyone wants to talk to someone about getting screened and tested for COVID-19, you can still call our COVID-19 hotline at 844-442-5224. They can screen you and then let you know what's the closest testing location available to you. And that Red Cross resource, again, is great for donating plasma. It's redcrossblood.org/donate blood. And that'll be a great place for you to find out how to get involved with that trial. Thanks so much, Eddie. We'll talk to you next time.
You got it.
Bye.